Did you ever take a test in high school or college and there was a curve on the grade where sometimes the highest grade that was obtained in the class was like a 76%, so that became the A? Think of the normal lab values just like that. You are normal even if you're getting a D. But when it comes to your health, you don't want to get a D. You want to get an A or a B. So let's talk about where adrenal fatigue shows up in the blood work. The two most common numbers that a functional medicine provider is going to look at are your sodium and your potassium. Sodium, you want to be between 135 and 140. If it's high or low, it's a sign of adrenal issues. Potassium, you want to be between 4 and 4.5. If it's high or low, it's a sign of adrenal issues. Some other numbers that you might pay attention to, because your adrenals definitely need a lot of vitamins and minerals, your alk phosphate. If it's below 44, it's a sign that your adrenals are struggling because they are not getting what they need. But also, you'll see this other places. If your TSH comes back out of range, low or high, so if it's below 1.8 or above 3.0, and there are not significant thyroid antibodies present, the TSH is a measure of your pituitary. Adrenals control pituitary. So we know there's something wrong with the adrenals because the pituitary is not right. Some of the symptoms of adrenal fatigue or adrenal exhaustion can get confused for other things, like say low iron or poor methylation or poor liver function, because all of those typically come with some level of fatigue. Now, the liver function a lot of times also comes with nausea that occurs especially around meal times. And we know that people are then struggling with something digestive. But also, if you're somebody who is thin, like I met this woman the other day, super thin. She's a size 0, y'all. A size 0. But her face looked too big for her neck because it was puffy. So that puffy face, it's like the opposite of Ozempic face. It's puffy. There's no definition in the cheekbones. There's no definition in the jawline. It's just puffy. Or if you're somebody who has kind of a round belly, you're not overweight, but your belly's a little puffier than you want it to be, and your legs look amazing, and so do your arms, and you get compliments on them all the time. Adrenal issues. Other signs that you might have an adrenal issue, let's say you sprain your ankles often, or you have low back pain that comes on in periods of stress. Adrenal issues. Let's say that you sprain your ankle, 6 months later, it's still not healed, even though you went to physical therapy, you did all the things you were supposed to do, and it still hurts all the time and feels unstable. Adrenal issues. Why? Cortisol doesn't actually allow you to heal. It reduces production of testosterone. So by that measure, we could also look at the hormones, not just thyroid hormone, but we could look at the testosterone. If your free testosterone is low, even as a female, that could be an indication of adrenal issues, especially when we combine all of it together. One of the major things that I look at, though, is if the red blood cell count is fairly within normal, and I mean within functional, optimal, and the iron panel comes back within optimal range, and they have that I'm bone tired all the time, sleep for 12 hours, wake up exhausted, feel unrested, adrenal, and we treat for it. And the way that we treat for it is with nutrition and a little bit of supplementation. But we also then have to look at whether or not the gut's working. Because I had this person who filled out my forms this week. He's taking a ton of stuff. And in fact, most of his supplements have overlapping items in them. But all of his symptomology is still symptomatic of some significant vitamin and mineral deficiencies because his gut's not absorbing stuff. And if you look at the questionnaire, you can tell he has gut issues without testing. And then when you look at his blood work, you can see leaky gut. He's not absorbing protein. He's not producing globulin. He's not getting the appropriate amount of albumin. So all of these are things that tell us where the body needs support. If your endocrinologist said no, it could be that they don't know what adrenal fatigue actually looks like. I had a woman in my office who had a torn rotator cuff. She came to me for physical therapy. 6 weeks in, she wasn't getting any better. And I was seeing her once a week for 6 weeks. And I asked her, has anyone ever tested you for stuff going on with your adrenals? And she said, like what? And I said, well, specifically something like Addison's. And she said, why? And I said, because you told me what you eat last time you were here. Your shoulder's not worse, but it's not better. You made progress for the first 3 weeks, but the last 3 weeks there's been no change. And you have a really puffy face, a really puffy body, and based on what you're eating, you shouldn't. But your legs and arms are super skinny. I sent a note to the orthosurgeon and said, look, she's not getting better. I suspect Addison's disease. He ordered a blood test and an MRI. She had a pituitary gland tumor that was creating Addison's disease. If it walks like a duck, quacks like a duck, it's probably a duck. And just because we don't know how to treat something doesn't mean that we shouldn't acknowledge what's happening in the patient. I mean, there was just a study released that said that the American Endocrinology Association recommends not testing vitamin D because they're not exactly sure how to treat the deficiency. So that's our answer. We're just not going to test for it because we don't know what to do if we find the problem. That makes a ton of sense. The body is not 88 different subparts, which is how many specialties there are in the medical world. It is one whole ecosystem. And until we start treating it like one whole ecosystem again, we won't make progress in overall health in this country.